been involved in the university. And I remember during the lunch break at one of the meetings, I told Professor Binka that he was a member of the committee, and I told him that you are going to be the first vice chancellor of the university, and he said I should clear off, but it has happened. So that is a historical perspective. Mr. Chairman, the vice chancellor, the registrar, Medical and Dental Council, my mate in Leeds, Nuffield Institute, deans of schools and faculties, distinguished invited guests, our celebrants, parents, friends from the media, ladies and gentlemen. It gives me great pleasure and a sense of excitement and nostalgia to be part of this year's White Coat ceremony for our medical students. And these are the students of this noble university. Indeed, it is an honor done me to be asked to give the keynote address on this occasion. Let me take this opportunity to express my deepest gratitude to the Vice Chancellor, the Dean of the Medical School, and the Planning Committee for the honor. I can say with pride that I am qualified to be doing this not because of my academic credentials, but because of the following reasons. One, I have been a medical student before and can remember how excited I was when we were done with the daunting basic sciences and the other preclinical courses and were being ushered into the wards to begin our clinical studies. I know what it means to wear the white coat for the first time. And with the stethoscope and the patella hammer in our pockets thereafter, we also had a name tag which we aspired to. I spoke to a colleague, the doctor, yesterday about how he felt the first day he wore the white coat to the ward, and he said, and I quote, "That day I wore a new trouser and a white shirt with a tie to match because I realized I was then at the threshold of realizing my dreams of becoming a medical doctor. And that day I treated myself to a special meal," unquote. Today's event brings memories of my own experiences many years ago, and I will not tell you the class I belong to. The second reason why I think I am qualified to do what I'm doing now is that a few years ago, I sat in the audience as a parent on a similar occasion at the Cape Coast University. So I know exactly what parents go through to get their awards to this level of education. The third reason is that I also assist this university as a part-time lecturer, and so I know what lecturers go through to be able to impart knowledge and skills to students. And finally, a few years ago, I was on the other side of the consulting room table and the theater tables receiving care from practitioners. So I'm qualified. Mr. Chairman, I would therefore like to congratulate all the students for working so hard to reach this level of their education. I would also like to commend the parents for supporting the students to this level. I know it is not easy, and you are not done yet. And I thank all the lecturers for what you are doing to give quality training to the students. Mr. Chairman, as medical students are about to commence their clinical component of the medical course, they will spend most of their time in health facilities where they can experience the real-life situations of what they have been taught in the classroom. It is expected that their presence in these facilities will further enhance their appreciation of the theories and concepts they read from textbooks. Besides, it is an opportunity for them to develop their interpersonal skills as they work with multidisciplinary healthcare professionals in teams. How much they learn will greatly depend on how effectively they are able to interact and communicate with these healthcare professionals, their colleagues, their lecturers and mentors, and above all, their patients or clients. Mr. Chairman, healthcare institutions are governed by rules, regulations, and protocols, among others. Medical students are expected to operate within these regulatory and policy frameworks of the facilities. For example, health personnel are regulated by the professional codes of conduct, and it is expected that as students, you will do well to live up to the tenets of these codes to avoid dragging the noble profession into disrepute. In addition, there are established procedures and protocols that guide the work of clinicians, which you will encounter in the facilities. Students are expected to learn them as quickly as possible because they form the basis of your future clinical practice. Furthermore, our patients or clients in the facilities have both rights and responsibilities as codified in the Patients Charter of the Ghana Health Service. As medical students, you are under obligation to respect and uphold these rights at all times, regardless of the nature of their conditions. Quality of care is critical in service delivery and must be held in high esteem. In your practice, you must aim at improving health outcomes, minimizing complications and disabilities, and above all, saving lives. Medical negligence and unprofessional conduct must be eschewed. That is why the registrar is here. Your dressing, ladies and gentlemen, must be appropriate and smart. For the ladies, miniskirts or pencil dresses which will not allow you to bend and examine patients must be avoided. For the gentlemen, t-shirts